Welcome back to the deep dive. Today, we're jumping into a topic that, well, for many people might still sound a bit surprising, maybe even controversial: psychedelic therapy.
Hmm.
Our mission, like always, is to quickly get you the core insights from the material you've shared so you feel well informed. We're going to unpack what this therapy actually is, what its potential benefits are, the crucial risks involved, and how it's being used right now in controlled settings, all based on the sources provided.
Exactly. And the goal here is really clarity. We want to give you a solid, informed understanding of this emerging field, helping you feel informed without, getting totally overloaded. We'll stick to the science and the practical stuff in the sources.
Okay, let's unpack this then. When we say psychedelic therapy, it's really important we draw a line between this and, say, recreational use. Based on our material, what's the core definition that makes this a distinct treatment?
That's a really key distinction. What we're talking about is a very structured, medically supervised approach. It involves using substances like MDMA, psilocybin, LSD, and this is critically administered in a strictly controlled clinical environment. It's not just the drug, it's the whole package. The setting, the therapy support around it.
Right, the context. And what sort of conditions is it aiming to treat? The sources mention quite a range.
They did. It's being looked at for severe depression, PTSD, anxiety, different kinds of addiction, and even existential distress.
Yeah.
Particularly mentioned for cancer patients dealing with that end-of-life anxiety. It's about finding new options for some really tough situations.
Okay, here's where it gets, well, really interesting. The potential benefits. This is why it's grabbing headlines, right?
Yeah.
Expert, what really stood out from the material about how effective it might be, especially for something like severe depression?
Yeah, what's really striking, particularly for severe depression, is this claim that just 1 or 2 sessions, well, they can show major relief, especially for people where traditional antidepressants haven't worked. That's pretty significant.
Wow, yeah.
It's not just another option. It feels like a potential shift in how we even think about treating these conditions. Imagine going from maybe years of medication to potentially transformative short interventions. It really challenges the long-term approach we've had.
That really is a powerful idea. And then for PTSD, there was something specific, wasn't there? This breakthrough therapy status for MDMA-assisted therapy. What does that actually mean in the bigger picture?
Well, getting that breakthrough therapy status from the FDA, it's more than just jargon. It signals a real shift in, let's say, mainstream medical thinking, because the FDA sees enough strong evidence to speed up its development,
Okay.
which could make it accessible to many more patients, much sooner than maybe people thought. It could genuinely reshape how we treat PTSD.
And it wasn't just depression and PTSD. We also saw some promising signs for addiction, too, didn't we?
Absolutely. Psilocybin therapy, for instance, is showing real promise for helping people quit smoking, tackling alcohol addiction, and even other substance abuse issues. It seems to tap into something that helps break those really ingrained patterns.
And speaking of deep-seated issues, the research also touched on something profoundly human: existential anxiety, like you mentioned, for cancer patients facing the end of life.
Exactly. For people facing terminal illness, psilocybin seems to help them find a sense of acceptance, peace, even when dealing with that intense death anxiety. It's about finding some calm, maybe some resolution in just incredibly difficult circumstances, a kind of deep psychological and maybe spiritual support.
Then there's this other fascinating angle: neuroplasticity. The idea that these substances might actually help the brain form new connections. Can you expand on why that's useful? For learning, changing behavior?
Yeah, think of your brain like a landscape with established trails. Habits, thought patterns, fears, they become deep grooves over time. Neuroplasticity is the brain's amazing ability to basically carve new paths, make new connections. The sources suggest psychedelics might act like a temporary reset. They might loosen those old rigid patterns,
Oh.
making space for new, maybe healthier ways of thinking and reacting to form. That's why it could be so powerful for things like addiction or PTSD, where people feel really stuck.
So it's literally helping rewire things. And beyond the brain science, the material also mentions these more subjective experiences, people describing them as spiritual or life-changing.
That comes up a lot.
Yeah.
Individuals often report these really profound, deeply meaningful experiences. And the research notes this can lead to genuine positive shifts in how they think and behave long after the actual session is over. It's like the inner experience translates outwards.
Right. Okay, but a deep dive means we absolutely have to look at the full picture. The risks. It's so important to understand the counterbalance here. Expert, what are the main risks that the material brought up?
Yeah, absolutely essential. So the first thing is the experience itself, the potential for what people call bad trips, right? Intense psychological distress. The sources warn that without a safe, controlled setting, you could experience things like hallucinations, panic, fear, paranoia. The environment is just critical.
And it's not just during the session. We also need to think about who this is actually safe for. There was some pretty serious warning.
Very serious. The research really emphasizes that it can be dangerous, potentially very harmful for people with conditions like schizophrenia or bipolar disorder. So screening is absolutely vital. It's definitely not a one-size-fits-all treatment. Careful patient selection is non-negotiable to avoid making things worse.
And it's not purely psychological either. There are physical risks too, like LSD affecting heart rate.
Yes, that's mentioned. Things like increased heart rate, blood pressure, particularly with substances like LSD. So medical monitoring is part of that controlled setting. And then there's the question of dependency. The material points out an important nuance here. While the classic psychedelics aren't generally seen as addictive like, say, opioids are,
Right.
misusing them can lead to a kind of psychological dependence, relying on the experience itself maybe instead of doing the integration work. So guidance is key.
And the last very practical point, the legal situation. You can't just get this therapy anywhere.
No, definitely not. These substances are still illegal in most places. Access is generally limited to approved clinical trials or, in some areas, very specific regulated therapy centers. That legal status really dictates how and where this can happen, which leads us right into, well, how it should be done properly.
Okay, so given all those risks and the legal side, how is psychedelic therapy done safely and effectively? According to our sources, what makes up that controlled environment?
Well, the material couldn't be clearer on this. It must be in a controlled clinical setting. That means under the direct supervision of a properly trained therapist. And the space itself needs to be intentionally safe, calm, designed to minimize distress.
And dosage isn't random, right? It's carefully managed.
Oh, absolutely. Low to moderate doses are typical, and they're tailored to the specific person and their therapy goals. MDMA therapy, for instance, usually involves just 1 or maybe 2 sessions with the substance itself. But those sessions are embedded within a much longer process of regular psychotherapy before and after.
And that after part seems critical, this integration therapy step. Can you explain why that's considered so vital?
This might be the most crucial piece, actually. After the psychedelic experience, the therapist works closely with the patient. They talk through what came up, what insights were gained, and figure out how to weave those insights into the person's everyday life. It's about making those profound moments stick, turning them into lasting change in behavior or perspective. Without integration, the benefits might just fade.
Yeah, that makes sense. And just to hammer the point home, the material has a really strong warning against any kind of self-use or unsupervised experimentation. Why is that so heavily stressed?
Because the risks, both psychological and legal, are just incredibly high without professional oversight. The potential for frightening experiences, for worsening underlying mental health issues, or getting into legal trouble, it's just not worth it. This is powerful stuff, and it demands a properly guided, supportive environment. It's absolutely not DIY territory.
Okay, so where does all this leave us? What's happening right now at the cutting edge? Who are the key players driving the research?
When you look at the latest research, 2 names pop up again and again. Johns Hopkins University and MAPS, that's the Multidisciplinary Association for Psychedelic Studies. They're really leading the charge, doing a lot of the crucial work.
And we heard that psilocybin and MDMA therapies are now in phase 3 trials. What does that actually mean? Why is that a big deal?
Phase 3 is huge. It's basically the final stage of clinical testing before a treatment can be considered for widespread regulatory approval, like by the FDA. Being in phase 3 means these therapies have already shown promising safety and effectiveness in earlier, smaller trials.
So it's pretty far along the pipeline.
Exactly. It suggests there's a real possibility they could become legally available medical treatments relatively soon.
And speaking of soon, there's this quite specific projection mentioned, possible FDA approval by the end of 2025, specifically for PTSD treatment using MDMA. That would be massive.
It would be a landmark moment, absolutely.
Yeah.
If that happens, it truly opens the door.
So, wrapping this all up for you listening, what's the big takeaway? Psychedelic therapy, it's clearly complex, it's evolving fast, it holds some really significant potential for helping with tough mental health issues, severe depression, PTSD, anxiety, addiction. But, and this is a big but, it also carries considerable risks. That means strict, controlled use, always under professional supervision, is absolutely essential. It's a powerful tool, definitely not to be taken lightly, but one that really could shift how we approach mental wellness.
Yeah, I think approaching this scientifically is key, understating the promise, but also respecting the boundaries. The sources make it clear. Getting the benefits safely really depends on that rigorous research, careful ethics, and, I'll say it again, supervised use. Avoiding misuse is paramount.
So, thinking ahead, with this research progressing and potential approvals on the horizon, how might this change the landscape of mental health treatment in the next few years? And maybe even broader than that, what kinds of conversations will this push into the open as it becomes potentially more mainstream? Something to think about. Thank you for joining us on this deep dive today. We hope you feel a bit more informed and definitely encourage you to keep exploring.